When an infection reaches deep into the lungs and causes the air sacs to fill with fluid or pus, your patient is in a fight for every single breath. So we're talking about pneumonia. This isn't just a bad cold, y'all. It's an inflammatory process that can lead to septic shock if you don't manage it correctly. So go ahead and grab your notebooks and meet me right back here. But before we start, hit that save button. Pneumonia is a cornerstone of your Med Surg respiratory unit and a high frequency NCLEX topic. Okay, so drop a in the comments if you've already started your respiratory assessments and clinicals. Okay, so step 1 is the patho breakdown. Pneumonia is an inflammation of the lung parenchyma caused by various microorganisms, including bacteria, mycobacteria, fungi, and viruses. When these pathogens invade the lower respiratory tract, they trigger an inflammatory response. Okay, the alveoli, this is where gas exchange happens, okay? The alveoli fills with exudate, which is fluid and white blood cells. So this buildup interferes with the diffusion of oxygen and carbon dioxide, leading to hypoxemia. Step 2, risk factors. You have to know who is most vulnerable, all right? Here are some critical triggers. Travel or exposure to certain environments, right? A history of smoking and pre-existing conditions like heart failure, diabetes, or alcoholism. Patients who are immunocompromised or those with suppressed cough reflex, like those who have had a stroke or are sedated, are at a much higher risk for aspiration pneumonia. If the lungs can't clear the invaders, the infection takes hold. Step 3, manifestations. So you need to recognize the signs of a body that's under siege. Look for sudden onset of chills and a rapidly rising fever. Your patient will have pleuritic chest pain when they breathe deeply or cough. You'll see tachypnea, which is a rapid breathing, and they'll likely have a productive cough with purulent sputum. On auscultation, you'll hear crackles or diminished breath sounds over the affected areas. Step 4, diagnostics. This is confirming the infection. So how do we prove that it's pneumonia? The primary diagnostic is the chest x-ray. This will show infiltrates or consolidation in the lung fields. We check for white blood cell count, okay, which will be elevated. And most importantly, we obtain a sputum culture and sensitivity to identify the specific organism. We also monitor arterial blood gases, that's ABGs, okay, to see how the infection is affecting the patient's oxygenation and acid-base balance. Step 5, these are nursing interventions. So your priority is clear, okay? Clear the infection and support breathing. You have to administer supplemental oxygen as needed and provide plenty of fluids to help thin out those thick secretions. Okay, you must administer the prescribed antibiotics promptly once the cultures are drawn. But what's most critical is the fact that you have to encourage the patient to perform deep breathing and coughing exercises. They have to use the incentive spirometer every hour while they're awake. All right, you want to position the patient with the good lung down or in semi-fowlers to maximize lung expansion and drainage. Step 6, education and signs of improvement. So what does success look like for this patient? Success looks like a trending down of the fever and a return to baseline respiratory rate and oxygen saturation. You want to see the patient clearing their own secretions and having improved breath sounds. Okay? For education, teach the patient about the importance of finishing the entire course of antibiotics and getting the pneumococcal vaccine. You want to teach them to recognize the signs of a relapse, like returning fever or increased shortness of breath. Okay, so that's it for this video, guys. But listen, when you understand these protocols, you aren't just passing a test, right? You're ensuring your patient can breathe easier under your watch. And also remember, everywhere you go, you leave a legacy. You're building a footprint of excellence. Your behavior and your clinical judgment speaks to exactly who you are as a person and who you are as a nurse. So think about it. What legacy do you want to leave? Make it one of vigilance, thorough care, and clinical excellence. And y'all, listen, stop overcomplicating your study sessions. Follow my 6-step framework and let's crush these exams together. And remember, I'm always leave y'all with this. Never dim your light for anyone. Stay lit.